We heard that students really wanted to be involved in healthcare while they were in school. And students need specific schedules. They need flexibility. They need the value of a student role, the scope that students can do, the competencies that they can leverage. I had the opportunity to create what we now call the Student Healthcare Assistant, or SHA. And so it's for students in the healthcare collegiate track, regardless of discipline, to give them an opportunity to work in healthcare, to learn our profession, to learn how much we care about people, and to really give them the flexibility they need in a student opportunity.
So I go to the University of Louisville. I started back in 2018. I graduated last year, but I'm still taking classes as like a pre-med. I was first introduced to working in a hospital probably last year when my friend Allie works here as a nurse.
So I know Ann, we met about 4 years ago. We actually worked at an outside job when I was in college. I let her know that we had the student program, and I thought it would be a great fit for her just to get her foot in the door and really get that patient care before she goes into medical school. So as a nurse, we have lots of roles and responsibilities throughout the day, and some of those roles can be giving medications and doing things that can get us very busy. The SHA can come in and help us do those tasks that really make a difference in the patient's day, like giving a bed bath, going in and changing their sheets, just small things that really make a huge difference, but it can change the patient's day in an instant.
With the help of my nurse managers, they've helped connect me with a lot of internal medicine physicians here. And they've always harped on continuity of care, seeing your patients get better and hopefully leaving the hospital. It's opened my eyes to what field I might go into potentially, but also just what working in a hospital is like and how a hospital is structured. And everyone here is so helpful with trying to educate me on the medical school process and what it's like being a physician. It's been really rewarding and really eye-opening.
When students come to us in the SHA role, there are human skills and there are clinical skills. And so the clinical skills are things that we highlight as far as that direct touch, that direct care. The humanness of what we do, that is the empathy, that is the caring, that is the heart to heart. It's very hard to teach that. A lot of times you just have to experience it. And so by giving our students the opportunity to come into our organization and experience that firsthand, to understand what it means to have a connection to someone face to face, to walk through that with them emotionally, to have some sympathy and maybe even empathy depending upon if they've experienced something similar too. Those pieces are not something you read in a book. It's something that you experience. And so within this role, it gives us the opportunity to allow our students to experience it firsthand.
I'd like to be here throughout medical school if that's possible, but I know that's really rigorous. But the schedule's really flexible, so I'm not sure. I'll try to work here as long as I can because it is really rewarding.